Come blast off in my time machine. Third eye feeling like an Visine. Blast off, blast off, blast off, blast off. Come blast off in my time machine. Third eye feeling like an Visine. Blast off, blast off, blast off, blast off.
Blast off on another amazing episode of the Hyper Anomalous Esoteric Research Organization podcast, aka Hero Paranormal, broadcasting from the base at La Madre Mountain, just south of Area 51. My name is Ryan, the anomalous ambassador of the airwaves, bringing you an unbelievable episode today. For what seems like decades, people have maintained that there are technologies which can heal in ways that have not been readily accepted by the status quo in medical fields. The technology has gone by many names. It has been portrayed in science fiction, novels, and television shows, but none has stuck in the minds of those discussing it as much as the term med beds, or medical beds. A healing device using either photobiomodulation, thermal, or infrared light, amongst other like technologies, to heal the human body from a variety of ailments. It seems as if these technology types are hitting mainstream medicine, but not without some pushback. Why would some want to keep healing technologies out of the reach of the masses? There may be a variety of reasons, but money-making may be one of them. As many have said before me, there is no money in the cure. Keep patients coming back to hospitals and the like, and pockets will bulge. Well, we have an expert to help illuminate our way through the darker, deeper questions surrounding a very light-based technology, helping many to recover from serious ailments, the MedBed master, Dr. Robert Bowen. Dr. Bowen received his degree in chemistry from the University of Illinois in 1974, and he received his MD degree from the University of Illinois College of Medicine in 1978. He completed residency in internal medicine and fellowships in critical care medicine, pulmonary medicine, sleep medicine, cosmetic laser surgery, as well as liposuction body contouring, and is a fellow of the American College of Chest Physicians, American Society of Laser Medicine and Surgery, and American Academy of Anti-Aging Medicine. Dr. Bowen is also professor and director of the Center for Wound Care and Hyperbaric Medicine at West Virginia University, Berkeley Medical Center. He is also the director of Robert Bowen, MD, specializing in cosmetic medicine and body contouring, and the president of the Foundation for Photobiomodulation Research, a nonprofit organization which fosters research, development, and awareness of light-based medicine using the synergy of academic, clinical, and engineering partners. His current research interests include medical, surgical, and cosmetic applications of minimally invasive procedures, adipose-derived regenerative cells, photobiomodulation, and pulse wave therapy. He is board certified in internal medicine, board certified in pulmonary disease, critical care medicine, sleep medicine, cosmetic laser surgery by American Board of Laser Surgery, hyperbaric medicine certification, and has a long list of academic appointments which are too long to mention. He has current grants, and he has presented on national and international levels at the American Academy of Anti-Aging Medicine, International Federation of Adipose Therapeutics and Science, National Society of Cosmetic Physicians, American Academy of Anti-Aging Medicine, International Federation of Adipose Therapeutics and Science, and has a long list of publications and current research and interests which are too long to mention. He is definitely the med bed master. Dr. Bowen, welcome to the Hero Paranormal Podcast.
Hey, Ryan, thanks a lot. I appreciate the invitation.
This is an honor. I have so many questions. I know that you know about these technologies more than just about anybody. And I've been fairly impressed, at least by people I've talked to. My wife is one of the people that has undertaken this therapy. And it seems that it has a lot of amazing effects. And I have a ton of questions. I'm not sure where to kick off. But I want to ask, in general, if you could describe to our listeners about the benefits of photobiomodulation therapy and smart medical beds.
Okay, so it turns out that our bodies, our cells, every cell in our body has light acceptor structures in them. Very much like the process of photosynthesis in a tree, the leaves in the tree where photosynthesis occurs, light helps us to make energy. Now, the main source of our energy, of course, is from the combination of carbohydrates and oxygen that produces ATP. But photobiomodulation has been shown in many different types of tissues and many different, from yeast all the way up to people, that it has a very powerful effect on the energy producing part of the cell, which is the mitochondria. So people say, well, this is, how can this therapy be so great? How can it work for everything? Well, it doesn't work for everything, but it works for all tissues that use oxygen. So that covers a lot of ground.
Recent scientific achievements and technological advances have brought this therapy a little more to the forefront of medicine. It's being more readily accepted where it was shunned before, but there still appears to be pushback. Why would you say this is?
Well, I think it goes. There's a culture in our country of wanting to take a pill for medicine or have surgery, and that's something that's it's true around the world, but it may be more true in the United States. But I think that this therapy was first discovered in 1967 in Hungary, in Budapest. So the idea that it came from, which was behind the Iron Curtain at that time. And so at that time, we mistrusted everything that related to the Eastern Bloc and to Russia. So there was that prejudice against any science that came out of that part of the world. So I think it started with that. But Dr. Mester, who discovered this effect, was a physician and also very interested in physics. And when, the lasers were just brand new at that point. Einstein had predicted that they could work back in the early 1920s, but one wasn't built until 1964. And Dr. Mester thought, well, other types of electromagnetic radiation like gamma rays, X-rays, ultraviolet rays are damaging to our body. So perhaps laser is going to be that way too. So he studied rodents. Rats were studied in. So he shaved their back and exposed them to different levels of energy with the laser. And to his surprise, none of them developed cancer, but the ones at a certain dose grew their hair back faster. So he realized that this was actually having a stimulating effect, not a repressive effect or a damaging effect. So that's where it started, and I think that part of the problem is that it's a therapy that's it's easy to do it, and there are no side effects, literally no side effects, and because of that, there's not much oversight in terms of from the FDA, for example. The FDA will clear these devices and say, yeah, they're fine to use, they're safe. But so the therapy is easy to do, but it's not easy to do right and have a positive effect. And some studies have been done with instruments that were not calibrated properly or just didn't know what the energy output was at all, and those have failed, sometimes because it was not enough light, sometimes because it was too much. So there is some conflicting information out there. But this is starting to gain more and more traction, especially as we understand what the biologic mechanisms are. Before the late 1990s, we knew that this worked for wound healing and other applications, but we didn't know why. But the work of Tina Carew in Russia, Roberta Chow in Australia, Juanita Anders at the Uniformed University in Bethesda, Maryland, all were pioneers at digging down and finding out what the mechanism and how this worked. And once we've had that for the last 20 years, we've been able to build on that. And in fact, now there's one FDA-approved use for light therapy, which is oral mucositis, which is when a patient with cancer chemotherapy or radiation therapy around their mouth and their jaw has this treatment, they can develop sores, which are extraordinarily painful to the point that a person may stop their chemo and just say, I'd rather die than go through this. And the light therapy is the only thing that helps that. And it's really a spectacular effect. If they're pre-treated with light, they don't get it in the first place. And if they have it and they're treated with light, they recover much faster so that they can continue their therapy, their life-saving cancer therapy. There's another dry macular degeneration, which happens to many of us as we get older, where our vision fails because of loss of retinal cells. Is another area where the studies have been done and the data is in front of the FDA, and I wouldn't be surprised if by the end of the year or the first quarter of next year that this won't be FDA-approved device for treating dry macular degeneration. So both of these companies, both of these applications are for problems that there is no other solution. So that helps gain acceptance for that because there isn't anything else. And it's like we're not comparing it to a pill because pills don't help.
Yeah, it does seem as if the system is very reliant on pharmaceuticals. And what I'm really blown away with is your track record and your interests as far as current research. And I see that I was very impressed that you're very involved with the isolation of adult stem cells from adipose tissue for different applications. And that's something that I took part in, and it completely cured me of 2 ripped shoulders. And they had some leftover material and they said, where would you want this? And I had tennis elbow in one arm, which I had been told by doctors was incurable on various occasions. I said, well, we might as well try it, put it here. And even that went away, which I was completely blown away by. So I definitely agree that the current research and your interests, not to mention all the community service you've done with Good Samaritan free clinics, this is stuff that is really helping people. And as healthcare budgets by insurance companies come under increasing pressure, I want to ask if this type of therapy, do you think this will alleviate the dilemma of these high prices in insurance policies?
Well, I certainly think it could help. And the therapy of photobiomodulation and other therapies that are being worked on for age reversal or anti-aging, or the preferred term now is health span. So yes, we want to live a longer life, but not just a longer life, but a healthier life. And there's some resistance to that whole idea because it's like, okay, well, people are going to live longer, they're older, and old people have old-fashioned ideas, and young people have fresh, new ideas. So maybe maybe it's fine for the old people to die off, and maybe so. If our population keeps growing, there's not going to be enough food for everybody, and there's not going to be enough jobs for everybody. So that's always in the background, obviously our Social Security system. If the average age that people die is going to be 115, which it likely will be before the start of the next century, then our Medicare and Social Security will be bankrupt in short order. And this is an ethical issue, I think, which maybe isn't talked about enough. We talk about the science a lot, but if we look at the life expectancy of the top 10% of earners in the country, it's 13 years longer than the bottom 10%.
Mm.
So that's a problem right there. But if aging is preventable with photobiomodulation, with these NAD therapies, with gene expression modification, with actually changing our DNA, these technologies are coming down the line. And if it turns out that these are only available to people that are rich because they're expensive, then this divide will grow and grow and grow. And to the point where people that are wealthy are able to they're able to keep their dogs can live to be 70 years old, then the rest of us are not going to take kindly to it, and now you've got civil strife and revolution around the corner. And I think that this is the answer. How can we? So these technologies need to be provided for everyone, and I think that we can do that if we have by keeping older people alive and productive longer, you've got more people, and you have people with wisdom of experience it's all hands on deck. In other words, to solve these problems of food shortages and poverty and tyranny and bigotry. All of these things require problems in society require all hands on deck. And if we can save money with these technologies, as you say, then we have, for example, an older person, somebody that's been in the war, is going to be very less likely to want to send more young men to another war. And our military-industrial complex and our medical-industrial complex suck up a lot of the revenue of our economy. And if we can reduce those, we have more money for health care. So the two things are related to each other, the way I look at it. So I'm glad that you brought this up because the science is fascinating to me on that intellectual curiosity level. But in terms of being an advocate for society, I think the gains, the potential gains are will have an even larger impact.
There has been, in my opinion, a push. More private clinics are seen popping up everywhere. And it does seem as if many of these treatments, both light technologies that are light-based and other technologies are, as well as the stem cells, which in some states are not even legal, but these definitely work. And it does seem as if many times these treatments are not covered under insurance. What would it take to integrate this photobiomodulation therapy, stem cell therapy, etc., into the healthcare system where insurances will actually start to cover them?
Yeah, so that's that's also a real good question, and that's something that we've been working on, I would say, the last 15 years, and with meetings at the Optical Society of America and testifying before congressional committees is kind of where we started with that. But where it goes first, so many of these devices for photobiomodulation in particular are FDA cleared. Okay, so that term cleared means that what they've evaluated is to see whether it's safe for use or not. FDA approved is another level where they say this device is approved to treat mucositis from cancer chemotherapy or blindness from macular degeneration. So that requires that's a higher bar to pass, much higher. So it's much more expensive. And these laser companies, LED companies, do not have the kind of funds that Pfizer and Glaxo have. And the system is built on to get approval for pharmaceuticals. That's the system that's in place. So we have to play their game, even though we're Pfizer and Glaxo are in the NFL. We're still we're still playing high school football. But at some point, probably soon, these larger corporations are going to see the benefits of this and buy out some of these smaller companies, and then the revenue will be there to do the FDA studies, the way that the company Lumathera has done for dry macular degeneration. And once you get FDA approval, there's still more steps. There's many things that are FDA approved that insurance still doesn't pay for, and that's true for cell therapies, as you were saying. Also, is that once you get the FDA approval, now you have to go to CMS or the Committee for Medicare. So anyway, I don't remember what the acronym is, but but they decide what Medicare and insurance companies are going to pay for. And if it's deemed experimental, as many of these therapies are, then it's not going to get paid for. The thing is about most of these therapies are that they don't necessarily have to be expensive. The treatment for macular degeneration, and we're talking about 2 lines on the eye chart improvement, to make it simple, is 3 treatments a week for 3 weeks, 9 treatments at about $30 a treatment. So that's $210. $210, whether insurance covers it or not. People will pay $210 to save their eyesight.
Mm-hmm.
So I think that's if we can't get insurance to pay for it, then we have to figure ways to make these treatments accessible for people using their own money.
I agree, and at least in my experience, when I heard about this pop-up, well, not a pop-up, but this clinic, that it was new to me, but I came to find out that many of my neighbors, a lot of business associates of my wife, word of mouth was spreading very quickly, like wildfire actually, about these treatments and how well they are working as far as light-based technologies and the like. And I'm amazed at how safe they are. The fact that you mentioned that there are no side effects, this is kind of a win-win. Even if insurance doesn't cover it, there's really no reason not to do it if you can afford it.
Yes, most certainly. I think that insurance will. So that's it for practitioners. That's a double-edged sword, because if insurance pays for it, they decide what they're going to pay you as a practitioner. It's no longer between the practitioner and the patient anymore. But if you're talking about procedures that are hundreds of thousands of dollars, then none of us have that kind of money laying around. So that's not going to be practical. And there are such therapies. I mean, gene therapy for cancer is often a few days of that is well into six figures.
And something that really blows me away is that there has been, or appears to be, more modern technologies coming down the tech pathway towards patients. And what are your thoughts about this rumor? Possible. I've read a little bit about different beds and technologies coming, plasma chambers. I was able to witness I want to make sure I say it the correct way, the infrared bed. And I was blown away that you could look right at it. And the guy said, yeah, don't worry. Because I obviously, when it fired up, I moved my head to not look directly at it. And he said, oh, don't worry, it won't ruin your eyesight. And I would ask you, what about these more modern technologies as they're coming down the pipe? Have you heard of anything mind-blowing coming that's intriguing?
Yeah, so we, a few years ago, I was talking more about light-based medicine. But now I think a better term is energy-based medicine. So we're using light, we're using shockwave therapy, sound energy. There's these plasma beds are interesting. Although what I've read about them, the claims seem outrageous, and I hope that they're true. But I think that technology is new enough that people haven't say, oh, well, look, this works, but we don't know why. Until there's a mechanism, it'll never be accepted by mainstream medicine. I do wound and hyperbaric medicine also. And so hyperbaric chambers are another type of therapy that's been difficult to get insurance to approve. But that is not an inexpensive treatment. The light treatments we can do for $25, $30, $50, as opposed to hyperbaric oxygen treatment, which is going to be $2,000 or $2,500 a session. And until you have 50 sessions, you haven't done anything. So that's something that clearly has to be covered by insurance in order to be practical. And the truth is that the PBM works just as well, perhaps better. So hyperbaric oxygen is I'm a big fan of it, and we do that in our wound center. But I'm hoping that in the next 5 or 10 years that we'll replace that with something less expensive and more effective.
Interesting. Another fascinating truth about photobiomodulation, or PBM, it seems that this is a very safe solution and possible, nationally, I guess the overdose deaths due to pain is pretty high. 49,000 deaths from all opioids, 19,000 deaths from prescribed opioid drugs. And PBM can be used to treat musculoskeletal pain, neuropathic pain, central nervous system disorders, and hard to heal wounds. This could be a way to really get down these national overdose deaths, couldn't it?
Yes, absolutely. So treating pain is one aspect of doing that. Although if we're treating pain with these types of therapies before they take pills, then we can prevent addiction. But when people are already addicted, it's a matter of changing their brain. Because it's like, even if the pain is gone, they need the drugs to feel well. And that's something that I've been just finishing up a study that we're doing to study the effects of photobiomodulation delivered to the brain on cognitive decline after COVID. So the quote-unquote brain fog that people have after COVID is what we've been treating in this study. And So we see improvements in memory and concentration, et cetera, but what fascinated me is what I've seen changes in the response time of the brain and the power of the brain. So the voltages that are the time that it takes for the brain to react, and the amount of the vigor of the response is something we can measure with EEG. And so we've been doing that before and after the treatments, and clearly we can change the brain function in about 15 minutes. And I had a colleague that I spoke to yesterday who does neurofeedback, and I'm not sure if you're familiar with that, but that's a type of therapy where EEG is done while the person is having therapy, and they can see their brainwave patterns and then try to adjust them. And I showed this data to my colleague, and she said, well, this I can do this with neurofeedback, but it takes 40 sessions, not 14 minutes. So I think so it works for brain fog, but I'm wondering what else will it work for? Alzheimer's, Parkinson's, Lewy body dementia, and addictions are all things that are possible targets for brain work.
I'm so glad you brought that up, because at the clinic where I go, I did notice that they had the the PBM helmet, and I was being told stories of some of the uses for it and how interesting it is from a neurological perspective and healing. And yeah, that seems like a huge deal. And I also noticed that under your intellectual property, you have an international patent for the use of oxandrolone, I hope I'm saying that right, in the treatment of COPD. Have you noticed any effects or helping features as far as people coming out of COVID, et cetera, with this treatment?
No, that was a study that I did almost 30 years ago now, and it was shut down because that was about the time that Ben Johnson was busted for using oxandrolone in the Olympics. So there was no more money to study those types of drugs. So how it helped the people with COPD is that at a certain point, you become so breathless that it wrecks your appetite. You can't you can't breathe when you're chewing, and or you'll aspirate. And so people have inadequate calorie intake, plus the amount of work that it takes just to sit and breathe burns up a lot of calories. So many of these patients become really overly slender and lose muscle mass. And so my idea was to use an anabolic agent like oxandrolone to try to build up their muscle mass. Doesn't help their breathing, but it helps them get stronger, and it helps break that cycle so that they can do more. Mm-hmm. So I don't know if it has any application at this point. I think the application would be for COVID if somebody has had a prolonged illness, been in a hospital bed, and has muscle wasting as a result of being inactive and having inadequate nutrients in the setting of a high metabolic demand of the illness. That would help them once they're over the acute phase, to help them recover their strength more quickly, so that they don't have to spend as much time in rehab. As far as I know, that I don't know that that's being done anywhere, but it's rational to think that it might help.
Yeah, and another question I had would be, you've probably seen a lot of patients. I would ask you about testimonials by patients using light technologies and what you've seen as far as cases. Well,
so I have a number of, as you might imagine, a number of devices that we use, and different wavelengths of light and different types of delivery work better for certain problems. So if you have a shoulder injury, a spot treatment around the area in the shoulder will be effective. If you have if you have rheumatoid disease or you have other autoimmune problems, then illuminating the entire body simultaneously is more cost effective and more effective. Period. So that's one way to approach it.
Okay, and what with the prices being what they are, and if they are not brought into mainstream as quickly as people are desiring, my question is, should people consider buying these products for use at home, or would you recommend using them at clinics with professionals?
Well, ideally it's both. So what I hope to do on the brain thing, I've been thinking about this over the last several weeks. Once I started crunching the data and seeing how well it worked, the EEG provides a powerful tool to see which patients are likely to respond. So they come to the clinic, we test them, before and after a light treatment. With the helmet or the bed, they both work, and see if they have a response in those delay times and voltages. If they do, then they could come back 2 or 3 times a week to the clinic, or they can buy a device to use at home, and then they can use it every day. And certainly, so for brain fog, coming to the clinic makes more sense because it seems to be self-limited. Once you're back to normal, you're good. But with Parkinson's disease or Alzheimer's that are degenerative conditions, you're going to need to do something on an ongoing basis to keep up, in which case it's going to be much more cost-effective to having a device for you to use at home. And the company that I'm working with is in the process of developing such a device. And other companies are too. Of course, there are a lot of direct-to-consumer companies also. The problem with that is that some of them are highly effective and some of them are junk, and you can't tell the difference by looking. So that's one of the goals of the Foundation for Photobiomodulation Research, is to have a center where we can test these devices, and the manufacturer would send us devices. And then they're evaluated, and then they get a report back that they can use, like the Good Housekeeping seal, and say, now we're not going to be like the FDA. We're not going to say, oh, this will work for knee arthritis. We'd say this device, this laser, has an output of X number of milliwatts per centimeter squared, and the time to use it is 8 minutes to get the therapeutic dose, rather than there's not very good quality control. And so if we have a way of controlling that, then it'll be the direct-to-consumer market will be more robust.
Yeah.
So the thing about the devices, it's like, oh, well, there's no harm in trying it. Well, that's true. It's not going to hurt you if you use it wrong. The worst that can happen is it won't help. But if you spend $800 on it, it's still going to make you mad.
Definitely. And something that recently blew me away looking into this was that photobiomodulating effects of light on irradiated tissue. So photobiomodulation therapy can help in management of cancer therapy-induced side effects. Have you come across this in your own work?
Yes, absolutely. So that's what the oral mucositis that I was mentioning. Oral mucositis is an effect it's a damaging effect of chemotherapy and radiation. And we've done that. We have done PBM. So patients it's not an unusual thing for patients in the wound center to come in with what's called osteonecrosis of the jaw, where they've had their jaw radiated 20 years ago and took care of the cancer. It worked great. They've been fine, and now they've had a tooth extraction, something simple, but the area won't heal up because the radiation has killed all the stem cells there 20 years ago, and there is no way to repair it. So that's an application for taking stem cells from them in from another part of their body and transplanting them to a part of their body that wasn't irradiated and putting that into that site, or using PBM, which will recruit stem cells for one thing, plus also allow cells to create growth factors that will promote healing.
That is so interesting. And I'm glad that you mentioned the tooth extraction just on a tangential note, because when I had my stem cell therapy, and I mean, my shoulders were shot, an odd kind of, I guess, side effect was I had recently gone to the dentist and I was told that I had gum damage and they had to do an extensive deep cleaning. And after the stem cell therapy, when I went back to the dentist about a month later, they said, wow, your gums look a lot better. Everything looks a lot better as far as the cells concerned. And it just, there seems to be a lot of advantages to this stem cell research as well. Is that something we can discuss a little bit so listeners have an idea about that? And why isn't it legal in every state?
Well, because so there's an overlap between stem cells and PBM. In fact, that was one of the main areas of my research several years ago when I published that article on isolating stem cells without using a chemical process from adipose tissue, from fat. Then what we looked at adipose tissues in culture, and PBM applied to the culture plates allowed those cells to grow faster. And so when we transplant them, so now it's common for me. Now, where I transplant cells is to the face for cosmetic purposes. So we're taking fat from some place the patient doesn't want it and put it back in their face. And following the treatment, we do, for several weeks, we'll do PBM to make those cells more robust and less likely to die off, and patient loses the volume that has been replaced. So there's been claims, PBM is good for getting rid of fat. Well, my experience is that it helps fat. It doesn't get rid of it. But so stem cell therapy, more to your question, the stem cell therapy is, a lot of things are called stem cell therapy that aren't. Mm-hmm. For example, treatment with so there is no off-the-shelf. Well, let's buy some stem cells and put those in this patient's knee. What the product that holds the most promise in this area to me is where they harvest cells from college-age persons, grow them in tissue culture, and then not take the cells themselves, because they would, if you inject cells from someone else into a patient, they will reject them because of being foreign proteins. So we don't want, so we don't do that. But what they do is that these cells secrete growth factors into the medium that they're growing in. Those can be harvested in exosomes, is what that's called. And so there's no cell products in there, but they do have the growth factors that will promote new blood supply, for example. And so when the salesman would come from a company and say, we're going to transplant these umbilical stem cells and you can use those for your wound care, and it's like, well, So that's true, but the cells have been frozen. They're dead. So what happens is when you put them in the patient, what they do is they dump out their growth factors. And so the technology works, but it's billed as a stem cell therapy, and it's not. The cells are just a growth factor delivery system. So I think there's a lot of confusion about what stem cells really are. We use stem cells from bone marrow to treat erectile dysfunction is one example. So we grow new blood vessels in the pelvis and into the penis from cells in the bone marrow from the patient's own bone marrow. Now, adipose tissue is not okay to use for that purpose. That has been banned by the FDA to use stem cells in a vascular region. You can use stem cells from the patient in the face. You can use them in the knee, for example. That's related to fat, but we would not want to be injecting fat particles into the bloodstream for sure. And even the cells themselves, that's going to require a company taking this to the FDA and making it a product. So I think that the growth factors, I think in the next 5 or 10 years, we're going to have something that's actually off the shelf and can be derived from young healthy people. So, you know, I'm 70 years old, so my stem cells are not as powerful as they were when I was 20. And so if we're treating somebody my age, we're treating their knee, we can use their cells, which will help. And the stem cells are somewhat protected from the effects of aging, but still there's a gradual decline in their vigor. So once we get something approved by the FDA, then I think this therapy is going to take off. In the meantime, we have these autologous therapies, which means from the patient themselves. So we can do that. We can take the patient's own cells and move them somewhere else. What we can't do is take somebody else's cells and use them. Number one, it wouldn't work, and number two, it's dangerous. And there's already been a lot of, not a lot, but there's been notable instances of people being blinded, having irreversible bad side effects from stem cell therapy, which we have not had with PBM.
And I'm really glad that you mentioned the bone marrow because it seems like there is a connection between PBM or photobiomodulation and having rejuvenating effects on aged bone marrow. Have you come across that? And I think just the fact that you're 70 is a pretty good way for you to sell this to people because you are in fantastic shape.
Well, thank you for saying so. It's important to. I think it's important for a physician to be a good model. I think it's it's good for all of us to be good citizens, so that our fellow citizens see how we're acting. And I think that that's especially important when somebody comes to the doctor's office. If the doctor's overweight and you can tell that he or she's been smoking in the back office, then what they tell you is likely to be discounted.
And sadly, that has been my experience. It seems, I hate to say this because it's just my experience, but having gone to doctors to take care of things in more mainstream hospitals, I've noticed that there is a lot of physician's assistants and doctors, et cetera, nurses that are overweight. They don't look like they're taking care of themselves. Yet when you go to these private clinics, everybody seems to be pretty put together and extreme portraits of overall good health.
Yeah, I don't think that's an accident. People often say to me, "Wow, you're 70, you look great." And I say, "Yeah, I got the technology, man."
That is so neat. And with patients spending less time in hospitals, do to some of these technologies. The future's obviously bright for medical bed manufacturers, doctors, etc., but there could be a portion, it seems, of the medical community that does not want this to take place. And my question is, some want to keep this healing tech, it seems, apparently, I could be wrong, but it seems like they want to keep it out of the reach of the masses. Why would that be?
Well, I think there's, a certain matter of protecting turf is part of it, and there are I'm not a person that believes in the pharmaceutical industry is evil. Pharmaceuticals have very greatly benefited me and my patients. It's just that sole reliance on this as a model is short-sighted. And we're not doing these therapies instead of mainstream medicine. They're integrated. They're adjuncts to the therapy. So it's like we're not using PBM to cure cancer. We're using PBM to allow people to have more efficacious cancer treatments that are in the mainstream and not get as sick from it. So that's how it is. So the things it's not either or. It's a matter of integrating them optimally.
So important. And these light-based technologies seem to be helping many to recover from very serious ailments that they would not recover from the same if they were just sticking to the basic procedures. And Dr. Bowen, I wanted to get into some of the therapies and applications, this minimally invasive type procedures that you recommend, what you have to offer, and where people can gather or get some of this light-based medicine.
So there, I think Googling PBM and then going there, clinics. There's the Foundation for Photobiomodulation website has some links to go to, and also some information, further information on the mechanism, how it works, the history, that kind of thing, for people that are interested in this to do some research on their own, and then decide what's good for them. That term photobiomodulation is new within the last 5 years. The term that was used before was low-level light therapy, and veterinarians have been using this for 30 years. They don't have to deal with the FDA, and you hear a lot of stories about old dogs that couldn't go up the steps, and after they have PBM treatments on their hips, they can run up and down the steps like they did 10 years before.
That is so interesting. And can this photobiomodulation, forgive me for not being more well versed in this, is that the same as AKA red light therapy or low level laser therapy?
Yes.
Okay.
So those are really synonyms. And the reason that we favor PBM now is because it kind of tells more of what it does. And like it's low level light therapy. Well, how low? Is it so low that you can't see it? It's a non-specific term, but it was invented to distinguish it from lasers used for cutting or ablation. So if you use more energy with a laser, you can you can operate with that. That's how I started in the laser business, was taking tumors out of the lung with a laser, and basically vaporizing them. But this is a much lower level than that. It's stimulatory rather than destructive.
Okay. And I'm aware that you are director for a variety of organizations, the Center for Wound Care, and also you're president of the Foundation for Photobiomodulation Research. And you have some connections to other nonprofit organizations which help foster research, development, and awareness of light-based medicine. If people are interested in coming under your care, I know you're back east, I'm over here in Las Vegas, where could people get a hold of you for any kind of cosmetic surgery? I know you've had a lot of celebrities and the like follow some of your cosmetic type surgeries, and as well as any of these other healing surgeries or liposuction, pulmonary medicine, etc. And you do sleep medicine as well. So you offer a wide variety of treatments. If anybody wanted to get a hold of you to take part in any of these, what's the best way to do that?
So I'll tell you in just a minute. But the thing about we'll just go ahead and do that. So my website is drrobertbowen, all one word, .com. So there's information there. The office number is 304-264-9080. Now, we're located in Martinsburg, West Virginia, which is about 70 miles from downtown D.C. and about 80 miles from downtown Baltimore. So we're in the eastern panhandle of West Virginia, within a pretty large population base in northern Virginia and Maryland, as well as D.C.
Great. And thank you for not only coming on the podcast, but explaining a type of medicine that a lot of people, I think this is critical, need to know about. I have been mesmerized and blown away by its effects on my health. And I know my wife had some very serious health problems, and she's been going weekly to get these types of treatments, and she is getting amazing results. And I would recommend this treatment to just about anybody, especially when there are seemingly zero side effects.
Yeah, well, and I appreciate being given the opportunity to talk about this stuff. I have a real passion for it because I think the future of medicine is very bright, and that was a pun. The pun was intended, but that the aging therapies in general are something that's going to change the world for the better, and so I'm very excited about that. The only thing that I worry about is the politicians blowing us to kingdom come before this can come about.
Yeah, and we have a couple minutes, and I know you're a very busy man. I appreciate you taking your time out of your day. There is also a consideration where photobiomodulation is being put before Congress. Can you tell us a little bit about that?
I'm not sure what you're referring to. There were several of us that testified to a congressional committee on innovations in technology.
Yep.
And that was it was before the pandemic. That was in 2019, I think, maybe 2018. So they've heard of it, and we do have the foundation does have I will say a lobbyist, because we're not paying him anything. He just has a lot of connections with official Washington, who has been putting a bug in the ear of the movers and shakers. So I think that's a good development too. And here in the Eastern Panhandle, we have Shepherd University has opened the Center for Excellence for Photobiomodulation, and they have some of these devices that they're using not in medical care, but rather for wellness. And the nursing program there, the nurses are taught therapy with photobiomodulation. We developed a curriculum for them. So what I'm hoping is that this part of the world, the Eastern Panhandle of West Virginia, will become the Photon Valley. So we will be a magnet for research and for engineering of laser and light companies and academic institutions to come and study this. It's like Silicon Valley, where all that is, where that intellectual and physical infrastructure is concentrated in one place. There's a lot of collaboration that can occur very easily. It's still in this day and age easier to collaborate with somebody sitting next to you than it is on the internet.
That is great. Thank you so much, Dr. Bowen, for your work bringing light-based medicine to the masses, using the synergy of academic, clinical, and real-world therapies, and also for kind of blazing the way for this technology to be accepted by our governments and medical community. I thank you so much for coming on today.
Thank you, sir, and have a good afternoon.
Man, what a guy. Dr. Bowen, blowing minds and healing bodies with light-based medical therapies and therapy research. Someone who has been on the cutting edge of not only developing and looking into practical uses of this therapy, but blazing the path for it to be more readily available to people like you and I. He is exactly the person I needed to ask the hard questions to. Not skipping a beat, I think it's apparent our medical field and future has some brightness coming its way. I love that pun Dr. Bowen sent our way. And this is all the while avoiding the pitfalls of opioid addiction for pain management. I can only hope that the efforts by Dr. Bowen and people like him will bring insurance companies to step up to the plate and spend a little to save a lot. And not just save a lot of money, but save a lot of lives. Until next time, keep your eyes to the skies, feet on the ground, but don't forget to take a look around.
Come blast off in my time machine. Third eye feeling like an Evazine. Blast off, blast off, blast off, blast off. Come blast off in my time machine. Third eye feeling like an Evazine.